My 25 years of practice, Equine Therapy 502, we're all about the horse being happy and healthy and being the professional athlete that they can be. We work closely with them and pay attention to what they have to say to us, and not just go in with our own agenda and think, okay, this is what this horse needs, instead of saying, okay, what do you need, and letting them tell us. It's a very important part of our business. This is a grade 1 horse that is a 4-year-old. We've worked on him for the last 2 years. He has some basic maintenance issues that we work on. Vicky's going over looking for areas that are tight, trigger points. She's checking for, those are points that are painful to palpate. So she's checking over his entire body to see what areas need therapy. It would be like running your finger down your thigh to check the muscle. If you felt an area, if you hit an area that was painful to palpate, that made you react, that would be how a horse reacts when we hit a point that is painful. We're starting a treatment here with this 4-year-old thoroughbred. Vicky has the Sound Vitality Chi machine up on his rear end. That's the white thing with the black tape on it. It's sound waves, alpha waves in the range of 8 to 14 hertz. So it's a very calming, relaxing sound wave. It's below what we hear. Ultrasound's above what we hear, infrasound's below what we can hear. So this is infrasound. So we're stimulating an acupuncture point on this horse's hind end to relax the whole hindquarters. The white wires and the white pads is electric muscle stimulation. This pumps blood to the muscle, helps relax the muscle, eases any pain or tightness in the muscle. This is a human machine made for people that we use on the horses. It is electric current, but it's very comfortable electric current. You can see by the way he's just standing here relaxing. It feels good to him. If it doesn't feel good, that means we're doing something wrong, and time to back up and check the equipment or check the area that it's being used on. On his feet, we have some infrared pads. This company is called Equi Light. It has infrared diodes. There are 60 diodes on each pad. And there are 4 pads, so we have them on the front and the back of his pastern, the part of the leg between the ankle and the foot. And that's where the arteries, the digital arteries are that pumps blood to the foot. If the horse has a foot problem, there's usually some heat involved, and by increasing circulation, we're carrying the heat away. It's very important to keep an eye on the feet, make sure the hoof is healthy. There's not too much heat, they're not too cold. The pulse to the foot, the blood flow to the foot is extremely important. Vicky's doing therapeutic ultrasound. This is a long wave ultrasound which comes from the UK. She's using gel there. We wet the hair down with arnica, which is a herbal anti-inflammatory. And then you use gel to transmit the sound waves into the tissue. So you're trying to increase circulation, relax the tissue in that area, relieve any pain or tightness in that area. All these machines are used on horses, but they're also used on people. Every machine that we use basically is made to use on people. Same as us, tissue, tendons, ligaments, muscles, blood flow, it's all basically the same. Our horses are so accustomed to it that they relax and enjoy it immediately. But we also, as trained therapists, know the individual animal and know if they're a little nervous or if something might upset them that normally upsets them. We know to look out for those kind of things and to keep the equipment out of the way and organized so it doesn't get in the horse's way. Our therapy treatments usually last around 45 minutes from the time we start and evaluate the horse, check the points, see what areas we want to focus on. Then we decide what modality we want to use, which is what machine, what form of therapy that we're going to use for what this horse has going on. We do therapy on the entire body, but we focus on the areas, like Vicky's focusing now on this horse's hip and gluteal area. So we focus on the area that we pick up tightness or trigger points that are painful to palpate. This is a pulsed electromagnetic field machine. We use it on our equine athletes to work out the tight spots, increase circulation. We want to loosen up any areas that are tight so they don't get off of that and cause something else in the body. The majority of our work is preventative maintenance. We do treat injuries, but most of our work is preventing injuries. So we work on these professional athletes to loosen up anything that's tight, relieve any soreness, pain, tightness to help them perform better and last longer at their job. Making a muscle contract pumps fresh blood to the area, which helps relieve any tightness. It also supplies fresh nutrients to the area. So you got an area that's tight that hasn't had good circulation in the area because it's tight. We're going to loosen that up. We're a fairly new industry in that equine therapy has only been around for 30 years now. There's only one education program available in the United States at Midway College in Midway, Kentucky. So there isn't a lot of training out there. A lot of therapists have apprenticeships with other therapists, which is an excellent way to learn. It's good to find somebody that's reputable, has been in the business for a while and knows what they're doing and uses multiple modalities. The pulsed electromagnetic field is really very simple. It's basically off and on, and then you have your intensity. It's very important to pay attention to your horse. If they're not comfortable, if they're saying no, if they're doing it for a reason, don't just think they're being bad. It's extremely important to know what you're doing with this machine or with any machine, as there can be adverse effects, or also as bad as an adverse effect is not getting any results at all. So it's very important to talk to an equine therapist before they work on your horse and find out what kind of training they've had, what kind of education, and what kind of apprenticeship. We've seen some really good results with the pulsed electromagnetic field on horses that seem to be just body sore all over. That could be from any number of reasons, from changing surfaces, going from one racetrack to another. The body has to adjust to a different surface, just like a human runner. This is how we want our horses to be during a session. We want them to be relaxed, sleepy, licking, chewing, eyes heavy. For preventative maintenance, that's a good schedule to do once or twice a week, especially when they're racing and breezing. I think educating people, educating owners, letting them know what all's out there that they can do for their horse, trainers as well. This is what's available. You know, we need to treat them like professional athletes. The trainers that we currently work for, they get it. They understand that they're professional athletes, and they want them around as long as they can possibly be around doing their job comfortably. And you know, that there again, that's a great part of our job. So if we can just educate people to what's out there to make the horses happy and comfortable and make them last longer and prevent injury, that's the biggest part of our job, is preventing injury. We follow the horses because they move from racetrack to racetrack, so we work in 3 different states moving around with the horses, which a lot of people think is a difficult thing, but really you kind of get used to living in 3 different areas, and we're in the wonderful weather all the time, which is a definite benefit of our job. This is Equitape. It's the equine version of kinesiotape. A lot of people have seen kinesiotape on professional athletes, at the Olympics, tennis players. A lot of professional athletes use kinesiotape. So we're now using it with the horses, and it's called Equitape. So we're doing this to support the horse's muscle, increase circulation, lymph drainage to the area. I'm using this form of kinesiotaping, Equitape, for my equine athletes. It supports the session that I did with this filly earlier. I used the machines to work out the tight spots, increase circulation to the area. So I use this tape to support the area. Tape can be used to support a muscle, to stabilize a muscle, to increase circulation in the area. It has many benefits. The horses, the equine athletes, can train with this on. The tape has waves in it. It doesn't have any kind of medication in it. The important part of using the tape is to know how much stretch to put on the tape, because you want it to stay on. It'll stay on for 2 or 3 days while they're training and performing. So you need to know, it's all part of being a trained therapist, is to know how much stretch the tape needs to have on it, and the technique for putting it on to keep the tape from coming off. And she'll feel warm in this area right away. She'll feel warmth from the increased circulation, the muscle relaxing. I've had several riders that didn't know that the horses had tape on overnight get on them the next day, ride the horse the next day, and they were very pleased with how much better the horse felt than the results we were getting from using the tape. This is a new laser that's on the market. It's called Spectral Laser. And what we're trying to achieve here is oxygenating the blood. So it's on for 12 minutes, off for 20 minutes. So we're increasing chemicals that cause the blood vessels to dilate, to increase circulation to the whole body. It's a new form of technology. We're always open to new equipment, what's out there, what's new on the market. They are professional athletes, and as a professional equine therapist, we need to stay up with what's new on the market and check things out and see what helps the horse the most. We are like the professional trainer to the equine athlete. The cold saltwater spa it's something that we've recently added to our equine therapy practice. It's a wonderful thing for the horses. The salt water has many benefits. The cold water obviously is wonderful with the jets in it. It's really good. It's great for joint pain, reducing inflammation. In the old days in the horse business, people used to use turbulator tubs that they would stand the horse in to get the turbulator action of the water. And this is just like the latest souped up version of the turbulator. You know, I always tell my girls, if you work from your pocketbook, the work won't come. But if you work from your heart, the work will come. We know it's a good session when they're nickering to us at the end or the beginning. He already knows it's time to stretch his neck. He's doing it on his own. You can see his range of motion is good in his neck. Good boy. Are you giving Vicky kisses? Are you giving her kisses? Good boy. Stretching the shoulder. Good boy. As you can see, he's giving it to Vicky and giving her full range of motion in that shoulder joint. The horses have so much to give. I mean, they never say no, they never refuse to race, they never refuse to train. They don't say, no, I'm not gonna do this, I don't wanna do this anymore. They say, what can I do for you today? So why can't we give something back to them? As I always say, we have the best job in the world. We help horses, we make them feel better.
There you go.
Yeah, they do. He's still stretching. Good boy.